It's John Porter. He's currently the president and CEO of the Bangor Region Chamber of Commerce, a position he's held for the past 3 years. Oh, darn. And he's a great guy. He's perhaps best known in Maine as a business and later opinion journalist with the state's largest newspaper, the Portland Press-Herald. In his 20 years at the Herald, he wrote often about the challenges of delivering healthcare in Maine, and as the editorial page editor in the late 1990s and early 200s, he helped lead public conversations about healthcare reform on the newspaper's opinion pages. He is currently responsible at the Bangor Chamber of Commerce for the Wellness Council of Maine, a statewide effort to promote workplace wellness. He also sits on the board of the Penobscot Community Healthcare Center and Maine's largest federally qualified health center. He is now going to make some brief remarks and then introduce our 20 in 20 winners.
Thank you, Nancy. For 2 decades in my former career as a journalist, I wrote often and sometimes in frustration about the lack of progress in reforming our healthcare system. And today, running one of the state's larger chamber organizations, I hear those same frustrations from my members. Always, when we survey our members, they cite the strain that healthcare costs places on their businesses as their top public policy concern. But there's some good news. Whatever one may think of the ACA, it is placing healthcare reform at the center of a national debate, a far better situation than in the 1990s and early 2000s when Congress simply punted the issue time after time. And there's some encouraging trends. Healthcare spending growth has slowed, and while the drop-off in utilization resulting from consumers bearing more costs is challenging providers in the short term, that's a really good example that shows that some things work the way we hope they will. And there is innovative work being done by providers, payers, employers, addressing the 3 major goals for reform: access, affordability, and quality. And I'm very proud to say that some of the best work being done in the country has been undertaken right here in Maine. I'm honored to be able to present these awards today to 20 individuals who are working to help the coalition in their quest to improve the health status of Maine citizens, reduce the total cost of care, and ensure that quality and patient experience of care is improved and protected as the health system is transformed. The 20 in 20 award competition was developed to help shine the light on 20 individuals who have made a difference in Maine during the course of the coalition's first 20 years. As you listen and appreciate these individuals and their accomplishments, please keep in mind that reversing the predicament we are in today will take more than the efforts of 20 individuals. We all need to be part of the cure. I hope you will learn from what has been done to date, mimic some of their efforts in your own organizations, and be inspired to replicate their achievements. The health of our state depends on it. One final note, the coalition received many worthy nominations, which is testament to the good work so many people in Maine are doing or have done over the past 2 decades. The judges for this competition had a very hard time determining the winners. Those judges were Dr. John Santa from Consumer Reports magazine, Ann Weiss from the Robert Wood Johnson Foundation, Harold Miller from the National Center for Healthy Care, Quality, and Payment Reform. The coalition thanks these 3 individuals for their time and energy in reviewing the many nominations submitted. And now to the winners. And because of the number of honorees and our tight time frame, we won't be asking our award winners to offer comments today. But we would ask that they... I give out a lot of awards at chamber functions, and you never have the winners speak. Never do that. But we would ask that they come forward once I've told you of their accomplishments to receive their awards. So, okay. First up, Charles Chuck Hewitt, COO of the Jackson Laboratory. It has been said that apart from the prevention of disease, the best chance of improving health is through improving the quality of care delivered to patients. Chuck Hewitt, COO of the Jackson Laboratory, has put his money where his mouth is and is using Jackson Lab's benefit plan to do both. Under Chuck's leadership, since 2008, Jackson Lab has been implementing the Jack's Fit Wellness Program in combination with incentives to use providers who are known to be both high quality and efficient. This has resulted in improving the health outcomes and functional status of Jackson Lab's 2,200 employees and dependents. Scores of Jack's coworkers have moved from high-risk to low-risk categories as measured by their annual biometric screenings, and hospital admissions, get this, hospital admissions among this group have dropped by over 50%. Chuck created a culture of change that is only possible when it comes from senior leadership. Congratulations, Chuck. Next, we have William Primmerman, Greater Somerset Public Health Collaborative. So health risks such as inactivity, obesity, tobacco use, poor nutrition, and unmanaged stress aren't limited to large organizations like Jackson Laboratory. Our next winner, William Primmerman, successfully piloted a cost-effective approach to wellness for some of Maine's smallest businesses, those with less than 10 employees. Bill and the Greater Somerset Public Health Collaborative developed a community-based wellness approach for micro businesses, and in so doing demonstrated that small employers within a community can join together to offer their employees wellness programs that would not normally be financially feasible for their groups and their size. During the 2 years of this project, Bill and his team demonstrated changes in both the environment of 24 pilot businesses and the behaviors of 110 employees. But more than that, he proved that even the smallest business owner can contribute to making Maine a healthier place to live and work. Well done. Next, we have Dr. Charles Berger, Martins Point Healthcare. Since the Institute for Health Improvement introduced the Triple Aim to America, Charlie Berger has been an unofficial IHI Triple Aim physician champion in the state. In 2011, Martins Point made his title official within their organization. Dr. Berger was an early adopter of providing clinical summaries to patients and their families as a means to engage and empower them to support their self-management. He also implemented new models of staffing to enable team members to work at the top of their license. But he is most known for his work with Dr. Larry Weed in developing and implementing the Problem Knowledge Couplet, an easy-to-access database of symptoms and clinical indicators that allows clinicians to quickly and accurately diagnose and manage illnesses and conditions. TV's Dr. Oz was so impressed with the coupler system and its potential to decrease the number of mistaken diagnoses, now believed to be at 25% of reported findings. I find that amazing. That ShareCare, of which Dr. Oz is a major investor, purchased the rights to the program. He will be giving a demonstration of the tools on a show in the near future, and it will soon be available all over the world via the internet. As a physician by training and an educator and innovator at heart, Dr. Berger is truly one of Maine's great healthcare resources. And apparently he brought his large extended family. Next up, Peter Driscoll, Executive Director, Amistad Incorporated. If Charlie Berger is a teacher at heart, Peter Driscoll is a chancellor. He spearheaded the shift of Amistad's emphasis from being an 800-member social club for people with severe and persistent mental health illnesses into a social force. The nonprofit is a peer support and recovery center for adults with severe and persistent mental illness. Charlie developed a peer coaching network of mental health patients that has a proven track record of reducing the frequency of unnecessary emergency room visits and improving the life expectancy of adults with mental health issues. Peer support is a powerful and affordable tool for facilitating the kind of knowledge, skills, encouragement, and linkages to resources that people need to adopt and maintain healthy lifestyles. Thank you, Peter, for unleashing this valuable resource to your clients and our community. Next, we have Dr. Dennis Schubert, Chief Medical Officer, Covenant Health Systems. With a career-long focus on improving the quality of patient care, Dr. Dennis Schubert was advancing the goals of the Triple Aim in Maine long before the term Triple Aim was ever coined. Following a long career as a highly regarded neurosurgeon, Dr. Schubert took on the challenge of becoming the state's first executive director of the Maine Quality Forum to drive efforts to increase transparency and accountability within the state of Maine. He also led the charge to develop a statewide shared medical records database, something he sees as the holy grail of patient safety. Dr. Schubert, we're happy to recognize you for your commitment to improving the quality of healthcare in Maine. And next up is Chris Duty, the CEO of Cary Medical Center. And I want to thank Chris. A couple of years ago, my son developed a horrible case of mono, horrible, as bad as it gets, and ended up in Chris's care when he was a student at MSSM. I just want to say thank you for the good care that he got there. But Chris Duty represents the kind of leadership that embraces the ever-changing field of health, while at the same time remembering how important personal, heartfelt concern is in the healing process. Chris is a true Mainer. She works with all her community to assure high-quality healthcare services at an affordable cost for all. Because of her efforts, Caribou is one of 5 locations in the country selected by the Healthcare Services, selected by the Veterans Administration to improve access to veterans by connecting them to services closer to home. And it is a national model for aligning the work of federally qualified health centers with their local hospital. The accomplishments of Cary Medical over her tenure are impressive and include, but are not limited to, an award for exceeding patient expectations for 7 years running, and the designation of being the best small hospital management team by Health Leaders Magazine. Chris, for bringing quality and innovation to the county, thank you. Next, we have Dr. Mark Fury, emergency room physician, Miles Memorial Hospital. As anyone associated with the coalition knows, helping a community understand that changing times and circumstances require changes at home is a difficult task. Dr. Mark Fury is being honored today because time and time again, he has led the Boothbay Harbor region's ongoing efforts to improve care quality and also to help his fellow citizens and peers reimagine how healthcare can be delivered in a better, safer, and more fiscally responsible manner. Despite being an emergency room physician, Dr. Fury advocated for eliminating emergency room services at Miles Memorial Hospital. And he did this because he knew that the community need for that resource was not there. And when the decision was made to transition the ED to an urgent care center, one of Mark's first calls was to the local ambulance service to discuss how they could work together to improve ambulance service training and technology in an effort to assure patients that they would have the highest level of care during recovery and transport. That work led to a state-of-the-art program that connects ambulance transport personnel with ED physicians the moment patients are encountered. Thank you. Next is Kathy Day, an RN and a patient safety activist. An analysis published by the Journal of American Medicine last month estimated that it costs the collective we who pay for healthcare services in America $10 billion annually to treat infections that patients contract while in the hospital. However, Kathy Day knows that hospital-acquired infections can have a much higher cost, the loss of a loved one. That is why Kathy has tirelessly worked to bring attention to and ultimately eliminate the problem of hospital-acquired infections. There are proven methods to significantly decrease the incidence of these infections, and Kathy is working to see that they are employed throughout Maine and elsewhere. We know that Kathy's father, John McCleary, a fatal victim of an infection acquired while in a hospital, would be very proud of her work, and we appreciate her ongoing efforts in this important field. Next, we have Dr. David, I'm gonna get this right, Giansiracusa. End-of-life decisions are deeply personal patient decisions, but too often family members are left with no guidance from the patient as to their feelings at the last stage of life. With care and guidance, patients need to be engaged to discuss their care preferences relative to their values and cultural beliefs, so that when care can no longer yield the results they want, their wishes for palliative treatment can be implemented. David is a part-time administrator at David is part-time administrative medical director at Maine Health and a full-time advanced care planner and volunteer. In both roles, he is promoting the value of collecting and sharing patient care preferences among patients and clinicians. Because of David's efforts, 11 counties in Maine have been reached and dozens of individuals have been trained in an evidence-based end-of-life care planning curriculum called Respecting Choices. In honor of David's work, and because it is the right thing to do, we urge you to visit the Conversation Project website and have this very important conversation with your own loved ones. David. Next, we have Dr. Amy Belle-Isle. She is the Director of Child Health Quality Improvement, Maine Child Health Improvement Partnership, Maine Quality Counts for Kids. Amy is on a relentless quest to improve the health and healthcare services delivered to children in Maine. After voluntarily leading a learning collaborative through the Maine chapter of the American Academy of Pediatrics in an effort to improve the care for young asthma patients, Amy continues to further this model as an employee of the state and Maine Quality Counts to expand it to other childhood illnesses. She is currently spearheading the Maine Health Improvement Partnership to measure child health improvement activities, the First Steps program to assure accurate, effective early preventive screening, and the Snuggle Me project to improve medical care and outcomes for drug-affected babies and their families. In addition to working with healthcare providers and organizations, Amy works with state agencies to review laws and policies in order to identify ways to improve care delivery. She works tirelessly to keep abreast of ever-changing medical evidence and then develops methods to integrate the use of that evidence into clinical offices serving children throughout the state. Amy believes that we can overcome shared challenges with shared solutions and goals, and she has secured results for the children of Maine by living those beliefs. Thank you. Next is John Benoit, President of Employee Benefit Solutions. All of us enjoy better, safer healthcare services in our state, in part through the vision of John Benoit. His desire to produce better, more efficient healthcare delivery in his home state led to the development of the Maine Health Management Coalition, which in turn energized clinicians throughout the state to improve healthcare delivery and to move towards reimbursement systems that reward health outcomes rather than simply health services. As we navigate a monumental transition in healthcare delivery in our country, Maine is supported by several tools for which John deserves much credit. A $33 million grant designed to help the state align Medicaid, Medicare, and commercial payers to eliminate waste and improve quality. One of the richest claims databases in the country, the capacity to hear what the data is telling us. And finally, this very coalition, a foundation of collaborative efforts that is recognized nationally as one of the very best state-based multi-stakeholder coalitions anywhere in the country. John not only founded the coalition, he continues to be a volunteer leader in directing the important work being done to improve healthcare in Maine. John, thank you for your vision and your continued leadership. Our next recipient, Dr. Robert Allen, is somebody I know well. I sit on the board of directors for his organization, and he has to tolerate hearing a former journalist ask really pointed and obnoxious questions, and I really appreciate that. Bob could not be here today. He's on vacation in France. I asked him the same thing at last week's board meeting. But Ken Schmidt, CEO of PCHC, is here. So many hospital admissions in our state are due to poor management of a chronic illness. And one way to prevent a hospital admission is to apply evidence-based care at the primary care level and deliver that care in a team fashion with community support. In doing so, patients can better manage their illnesses. Our next winner, Dr. Robert Allen, has led his organization through an extraordinary period of redesign and growth that has yielded impressive reductions in the need for hospital care, while at the same time producing high satisfaction rates among its patients. From integrating mental health services with physical health treatment, to expanding community support services, to collaborating with others in the very successful Bangor Beacon program, Dr. Allen has tirelessly led his organization, showcasing the results that smart and well-coordinated care can produce. On behalf of the 70,000 patients our organization serves, and here with us today is Ken Schmidt, our many thanks. Our next recipient, Dr. Peter Bates, is also not able to be with us here today, but let me tell you about what Peter has accomplished. As a Maine Medical Center trustee and a member of the Strategic Planning Committee, Dr. Bates led the effort to make population health one of 5 strategic priorities for the medical center in 2010. This was a novel idea for a tertiary medical center, and contrary to the vision that many hospitals today hold for themselves as places to heal people when they get sick. This effort is just one of many fostered by Dr. Bates inside Maine Medical Center as a way to move his organization toward a wellness maintenance ecosystem of the future, with realigned incentives designed to achieve patient-centered, effective, and affordable care. He has proven to be quite successful. Dr. Bates is not, as I said, able to be with us today, but we thank him. So next we have Ted Rooney. And Ted is the Executive Director of Aligning Forces for Quality Maine. Over the past decade, Ted has helped build a collaborative effort that has gathered and engaged multiple stakeholders at the table to measure and report the quality of healthcare in Maine, an effort that has resulted in measurable improvements in patient care. Ted's efforts have helped contribute to Maine's frequent status as one of the top states in the nation in achieving high marks in areas of healthcare performance and outcome measurements. Ted is passionate in his commitment to finding collaborative solutions to the many challenges we have faced as a state on the road to healthcare improvement. Ted is famous for pulling out just the right chart, graph, or diagram from his trusty L being green bag in order to make a key point just in time to persuade a colleague or to move along the initiative that is encountering resistance. With both our heart and our own head, Ted, we thank you for your efforts. Next is Dr. Barbara Crowley. With Dr. Crowley's leadership, Executive Vice President, Maine General, with Dr. Crowley's leadership, Maine General in Augusta and Waterville has developed a strong primary care base and a commitment to develop new delivery and payment models to improve care, including a pioneering financial risk model with the State Employee Health Commission. Barbara has worked collaboratively on many fronts in the state to promote high-quality care and control healthcare costs. She was a founding board member of Maine Quality Counts, in addition to the Aligning Forces for Quality executive leadership team. She is a very active member of several committees of the Maine Health Management Coalition and uses her skills to engage other physicians, hospital leaders, and other key stakeholders in endeavors to improve quality and patient safety as well as affordability. Somehow Barbara always finds the time to fit in one more project. When it's a goal, I'm going to start over with that. Somehow Barbara always finds the time to fit in just one more project, especially when the goal is to improve healthcare quality. We'd like to take a minute of her time now, though, to offer our thanks. Next, we have Teresa Brown, Chief Operations and Quality Improvement Officer, Eastport Healthcare Center. Washington County has a high incidence of colon cancer, the second leading cause of cancer death among both men and women in the United States, and it has a lower than average screening rate. Teresa Brown needed little convincing to take part in a pilot project of Maine Cancer Foundation and the Maine Primary Care Association that assured that patients would be informed about all their colon cancer screening options. Brown knew that when patients are given a choice of different screening modalities and information outlining the pros and cons of their options, they are more likely to follow through with their preference. She made sure that FIT, a low-cost option recommended by the American Cancer Society, was offered alongside more expensive options like colonoscopies to patients with no family history of colon cancer. Within the first quarter of informing patients of all their options, colon cancer screening increased by 10%, a significant achievement in an area of our state that faces high rates of poverty and low rates of insurance coverage. Today, Teresa still informs her center's patients of their screening options and counsels other practices on how they can successfully incorporate this shared decision-making process into their practices too, and by doing so, ensure that more patients get screened for colon cancer. Teresa, thank you for doing more with less. Next, we have Kevin Lewis, Chief Executive Officer, Maine Community Options. Kevin Lewis's entrepreneurial spirit has brought to Maine its first nonprofit, consumer-operated and oriented plan, or co-op, a health insurance plan designed to advance the triple aim of high-quality, patient-centered, efficient healthcare delivery. First, Kevin worked to secure a $62.1 million loan for the operation while directing the Maine Primary Care Association. And then he left that post to lead the new co-op run by its customers and insurers. His organization is dedicated to forging meaningful partnership with providers, employers, and patients, and along with Anthem and Maine Health, is offering his program on the insurance exchange beginning in January 2014. Kevin, we appreciate your boundless energy and commitment. Next, we have Dr. Lisa Letourneau, Executive Director of Maine Quality Counts. Perhaps it was during her years as an emergency room doctor that Lisa envisioned a better way to deliver primary care services that could eliminate the need for unnecessary emergency room visits and patient distress. Whatever the motivation, she embarked on an ambitious effort to change the way healthcare is delivered in Maine at the primary care level and never looked back. She is the driving force in re-engineering how primary care offices operate and connect with community resources. This approach drives better outcomes, lower costs, and gives patients a greater voice in their care. Lisa has taught practices in the state to look not just at the patients in front of them, but also at the patients who should be coming in. And she's talking to clinicians on how to engage patients and help them address the social issues that impact health. Because of Lisa and her willingness to work with others in the state, millions of dollars in quality improvement funds have flowed to the state. Lisa and her team were instrumental in Maine in being selected as one of only 8 programs nationwide to receive expansion funding from Medicare to further spread the development of medical homes. Lisa, on behalf of the patients you have helped and the physicians who you have helped reinvigorate through your work, we thank you. Next, we have Dr. Wendy Wolf, Maine Health Access Foundation President and CEO. The voices of patients and families, as well as their best interests, always lead the labors of Dr. Wendy Wolf, who has served at the helm of the Maine Health Access Foundation since its creation in 2000. As MHAF's leader, she has worked at the state and national levels to improve the access and delivery of care, not only for her key constituents, the uninsured and underserved, but all of us. Because she is a passionate and skilled leader, many in Maine look to her as an expert thought leader and as one who rallies others to address important issues. Everyone counts on her to ask important and tough questions. She understands and leverages the role that foundations can play as conveners and has used her post to establish comprehensive vision process for such an important quality improvement endeavors as integrating behavioral health and physical health services, improving care delivery through electronic medical records, payment reform, and increasing dental health services. She frequently connects individuals and organizations so that they can support and learn from one another's work. Her objective stance and her insistence that MHAF maintain nonpartisan operations ensure that Maine has a neutral platform to address critical health care delivery issues. Maine is better off because of Wendy's work. And last, but certainly not least, Dr. Jeffrey Alberg, Maine Medical Center, PHO, Chief Medical Officer. Dr. Alberg played a central role in the creation of the Maine Health Accountable Care Organization and its 4-point strategy for achieving better patient-centered care more efficiently. One key provision of this framework is the care management program that Dr. Alberg oversees. The program provides patients with extensive education, motivational coaching, and care coordination. Under Dr. Alberg's supervision, these evidence-based interventions have proven to reduce the readmission rates of Maine Health patients. Jeff leads by example with a passion for changing the status quo for the better. He is always on the search for holes in the system, and with authentic, passionate attention, he works to replace them with a system that assures better care for all. Thank you for your work, Jeff.
That was fabulous. Congratulations to all the 2020 winners. I'm certainly inspired. And certainly we do not have a dearth of leadership in this state. And as we all know, leadership is so critical to changing cultures, to bringing in new innovation, and having a new vision for the future. So I want to congratulate all the winners up here. And what a great state that I get to win an award within 30 days of being here. When is that? Talk about a warm welcome. I can't believe it. Anyway, you guys are too good in this state. I'm not used to it as a New York City boy. Anyway, we've come to the end of our symposium. Again, I want to thank you all for being here, particularly you in the room that have stayed to the bitter end. You get an extra cupcake on your way out as an award. I want to also thank our great speakers, great presentations that were made today. starting with the keynote presentations and the breakout sessions. Heard nothing but wonderful remarks about the faculty we brought together. And again, you know, when I think about a conference, what I always hope when I come to a symposium or conference, to take a little kernel of new knowledge or make a connection with someone that will help me do my job better the next day. And that's my hope for you in coming to this conference, that there was something that sort of was a catalyst for you or something that you hadn't thought of that maybe can help you when you get back to work tomorrow, as we all try to contribute to improving health, transforming healthcare, and lowering costs. So thanks again for being here. We'll see you next year at the symposium. And wait, what? And of course, congratulations to Nancy and her great staff for putting it. Nancy will be truly celebrating now that this is over. The champagne will be popped for sure.
No, I